Hello, my name is Shantia Carter of Art of Peace Wellness in Charlotte, North Carolina, and I am a therapist with over 20 years of experience. I've been in private practice therapy for about the last 3 years, but I've had my master's since the year 2000. I specialize, my private practice specialty is in helping helpers. I have teachers, principals, therapists, counselors, social workers, a corrections officer. These are the types of people who I have on my caseload. And these are people who help other people. It's paramount that when you're caring for other people, that you make sure that you stay full so as you can provide adequate care, and make sure that you don't get in the area of burnout. So that's my area of practice, my area of expertise. I use art therapy to craft a specialized self-care plan that is tailored for the individual, that they're able to do the things that they enjoy. I think every day you should work in things that bring you absolute joy, especially when you work with the public. But what I'm here to talk to you about today is how do you go from your couch? I'm home on my couch right now. And how do you go from your couch to a therapy practice, laying on the couch talking to a therapist? So from your couch to the therapist's couch, how do you get there? Perhaps you've already been kind of thinking that, been feeling kind of stressed out on my job lately. Wish I could talk to a therapist. If that is your bend and kind of how you're thinking, then I'm going to tell you today how you can move, what you can do, give you some recommendations on how to get the ball rolling. So what you're going to do is, I suggest starting with your employer. So if your employer you have your employee handbook handy, maybe it's in your drawer underneath all of your orientation stuff from years ago if you've been on your job for quite a while. Sometimes in there you'll find that under employee benefits you'll see something that says EAP. That's an employee assistance program. Under those programs, your employer has already made an arrangement with a local area therapist that will provide counseling services for you at a guaranteed rate. So your employer is going to pay for it. You're going to get the service you need, and they're going to tell you how many pre-authorized sessions that they'll give you to go to this therapist, and life will be peachy. So I say, go ahead and go to HR, your human resources officer or designee, or look in that book and find out how to get the ball rolling with an employee assistance program. That's method number one. Method number two, say you have insurance on your job. So you are on your job, you have maybe Stigma or Aetna. Those are the two insurances that I'm paneled for at Art of Peace in Charlotte, North Carolina. I also take private pay. But say you have one of the other insurances, United or Blue Cross Blue Shield. On the back of your insurance card, there should be a 188 number, 1888, or a 1-800 number, or a www, some web address there that is a clearinghouse that tells you what therapists take that insurance. So what you would do is, if you don't see something that says behavioral health benefit anywhere on there, you're going to want to go ahead and call them or contact them and find out if your insurance plan actually provides for a mental health or mental wellness or behavioral health benefit. If so, then they're going to give you a list of providers. It would be nice if they told you ones that were already accepting new clients, but sometimes that is often not the case. So you may have to put some legwork in on it, but that's okay. You're taking control of what you need. You're in the driver's seat. You're being assertive. So it's all right to move forward and ask questions and find out how to access these services. So that's method number two. Method number one was EAP. Method number two was flipping over your health insurance card and finding out. Method number three, you want to shop around, you want to find someone that you want to go to, that you like, that you share common interests with, or that you have a good vibe about. You can go to Psychology Today. There's a clearinghouse there. Art of Peace is listed as a provider on that particular clearinghouse. So you go in there in that database and you type in your area that you live in, and you type in what specialty that you need, or you can even type in, I call people in flavors. So if you want a vanilla therapist, you don't type in vanilla therapist, you type in the actual ethnicity. But vanilla, chocolate, caramel, whatever you're looking for, whatever flavor you need of therapists, they're on Psychology Today. So check that out. And that is another method. And if you're going to do that, you can either pay out of pocket, or you can find out if they take an FSA or SHSA card. So flexible spending benefits card or health savings cards. Those two accounts are pre-tax accounts that if your employer has that, most therapists will be able to take that. They have to do something called super bill, but they'll know what to do with that. So if you want to use your FSA or HSA savings card, your account card that has a Visa, MasterCard, or American Express major credit card logo, you should be able to use that to pay for your services. That's another avenue. And then last but not least, if you don't have any insurance whatsoever, you're working, you work very hard, but you just don't, that's not a benefit that any of your jobs offers, you can see if in your area there is a school, a college or university that teaches counselors. Because just like barbers and dentists and cosmetologists have to do people's hair and clean people's teeth and learn how to do it under the advisement of the professionals who are already licensed, so do therapists and counselors. So here in Charlotte, North Carolina, there is the Pfeiffer Institute for Marriage and Family Therapy. They provide that here. They're right off of Park Road, and they do sessions for $30. And so you can have a student that will follow you and help you get started with some of your healing under the umbrella and the watchful eye of a professor and a licensed clinical professional. So this is another avenue that you may have available to you that you may not have thought of. And then last but not least, there are the free clinics. Just like there are health free clinics for people who need medical care, medical assistance, some kind of coverage, because you have some need that has popped up and you don't have any money to cover it. In your area, there also should be or at least somewhere that's drivable or that you can get to that's not too far outside of your area. I know for rural areas it may be different, but I know in Charlotte we have two providers who will cover you no matter what your income, and that is Amara Wellness and that is Monarch. So if you can go to make an appointment with those two, or find out when they're, some of them have open access walk-in clinic days where you can go in and be seen by, at least get an assessment from a clinical professional that would be a therapist, and also possibly see if you needed to see the well, nobody has same-day appointments for the psychiatrist unless you are going to the emergency room, and they do in your area should have a psychiatric emergency room. So if they don't have one specifically like we do here in Charlotte, then you may just walk into an emergency department. If you're feeling that you are at the end of your rope and you are not well, go into the emergency room. They will make sure you get care. It may be a wait, but at the very least, at least you'll know that you'll be able to see someone, talk to someone about what's going on, and get some help. So these are all ways. And then lastly but not least, cash is king. So if you've got cash already, then you just find who you want, who you vibe with, and look them up, make you an appointment, and go. Now, if you don't know what to do on your first appointment, you're feeling kind of, I'm apprehensive. I've never talked to a therapist before. I have an answer for that too. Go on Elephant Journal. I have written 2 articles. One of them is what to do on your first appointment with your therapist. Therapy 101, some prerequisites of talking to a therapist. I'll put the link to that below, and please go ahead and like and subscribe if you have any questions that perhaps I didn't answer, or you just want to hear more from me as far as what to do or how to get started. I'll be happy to help in any way. But what I don't want you to do is sit and suffer in silence. There's no need to do that. I'm on my couch. I told you how to get from your couch to a therapist's couch. Go get help. Do not sit and suffer in silence. In Stigma. Stigma is the thought that, oh, I should pull myself up by my bootstraps. Oh, I should be able to pray these blues away. Oh, I'm just soldier up and be okay. That is not the way to be in these days and times. It's okay to get help. Your brain is inside your body. Your nervous system is inside your body. If you had heart palpitations and someone told you that you needed to see a cardiologist, you would go without a second thought. So just like your heart and your pancreas is in your body and you would take diabetes medicine and see an endocrinologist without a second thought, I need you to think about your mental health and your emotional wellness like that. I need you to say, I'm not going to sit around here and be depressed. I'm going to go get checked out. I'm going to talk to somebody. I'm going to unload and unburden this so that I can feel better, so that I can have the life that I want to have, so that I can stop being miserable. And maybe you're not miserable. Maybe you're just stressed out and you don't feel like you can talk about that. You can talk to a professional. I promise you. So what you want to do is get moving. So when you get done with this video, if you've already been thinking about it, go hit Psychology Today up. Go flip those insurance cards over. Get moving. Act like your health and wellness depend on it, because you know what? If you sit around feeling bad long enough, emotionally, it will take a toll on your physical health as well. So don't do that. You don't have to. Be light. Be peaceful. Be well, friends.